A 45-year-old patient arrives at the emergency room complaining of chest pain. As healthcare professionals, our first priority is to rule out life-threatening cardiac causes. We promptly perform an electrocardiogram and check troponin levels to assess for myocardial infarction or other cardiac events. The heart and esophagus share similar nerve pathways, which can make chest pain from gastroesophageal reflux disease, or GERD, feel similar to cardiac pain. In this case, the patient describes a retrosternal burning pain that worsens after eating and when lying down, but improves with antacids, classic features of GERD. Once cardiac causes are ruled out, we focus on the esophagus as the source of pain. GERD is diagnosed based on clinical features and exclusion of cardiac pathology. Management of GERD includes lifestyle modifications such as weight loss, dietary changes, and medications like proton pump inhibitors. To summarize, always rule out cardiac causes first in chest pain, then consider GERD and manage accordingly using a stepwise diagnostic approach. When a patient presents with chest pain, the first priority is to rule out life-threatening cardiac causes. Start with an electrocardiogram and troponin tests to quickly assess for heart attack or acute coronary syndrome. If cardiac causes are excluded, consider other sources. The esophagus and heart share nerve pathways, which can make their pain feel similar. This overlap explains why GERD, or gastroesophageal reflux disease, can mimic the burning pain of cardiac issues. GERD pain typically worsens after meals and when lying down, but improves with antacids. Always confirm a non-cardiac diagnosis with appropriate tests before moving to GERD management. Treat GERD with lifestyle modifications, such as dietary changes and medications like proton pump inhibitors. Use a stepwise algorithm to guide the evaluation of non-cardiac chest pain, ensuring patient safety and effective treatment. Chest pain is one of the most anxiety-provoking symptoms in medicine. But what happens when the heart isn't the culprit? Consider this case. An adult presents with retrosternal burning chest pain. The pain worsens after meals, increases when lying down, but improves with antacids and sitting up. Importantly, there is no shortness of breath, no radiation to the arm or jaw, and no diaphoresis. Vital signs are stable. However, the golden rule applies. Always exclude life-threatening cardiac causes first. An ECG shows no ischemic changes. With cardiac causes ruled out, we look to the esophagus. It shares the same nerve supply as the heart. This is why esophageal pain, most commonly from GERD, can perfectly mimic cardiac chest pain. Treatment focuses on acid suppression with proton pump inhibitors and lifestyle modification. Elevate the bed, avoid late meals, and watch trigger foods. The takeaway: chest pain demands cardiac exclusion first. But remember, GERD is the most common cause of non-cardiac chest pain. When the heart is clear, look to the esophagus. In this video, you'll learn how to distinguish chest pain caused by GERD from pain due to cardiac origins. Meet our patient, an adult with retrosternal burning pain that worsens after eating and lying down, but improves with antacids. First, always rule out cardiac causes. Order an ECG and check troponin levels immediately. This is a clinical imperative. Missing a cardiac cause can be life-threatening. The esophagus and heart share nerve pathways, which is why GERD pain can mimic cardiac chest pain. GERD causes acid reflux, leading to irritation and burning pain behind the breastbone. Unlike cardiac pain, GERD pain often worsens after meals or lying down and improves with antacids. Management of GERD starts with lifestyle modifications, like avoiding trigger foods, elevating the head of the bed, and weight loss. If symptoms persist, prescribe a proton pump inhibitor to reduce acid production and relieve symptoms. To summarize, always rule out cardiac causes first, then manage GERD with lifestyle changes and medication. Use a clinical algorithm to guide your approach to non-cardiac chest pain. Early detection saves lives. Always check the heart first.